My name is Dr. Toby Hamilton, and I am coming to you today from Houston, Texas at the Texas Medical Center, the world's biggest innovation and healthcare center. I'm the first in my family with my name to get a college education, and as a result of that work, I've got a real passion for taking care of people that work the way that I saw my family working regularly. I'm especially proud to say that in my entire clinical career, I've never turned a patient away for any reason. When people came asking for help and I had the skill set to provide it, that was something that I took on with pride and considered it an honor to serve the people that were seeking out my help. And more recently, I'm focused on delivering primary care cost effectively into rural communities that don't have care or access. The reason that I'm interested in addressing rural care in particular is being able to provide care to people that work really hard. My parents worked really hard, and sometimes we were not able to get the care that we needed. And as I looked at places that had hardworking people, people like my family, there was almost a universal grouping of those people in rural communities. So the notion that we could come up with an idea to take healthcare further and further out into smaller and smaller communities was something that appealed to me a great deal. You know, why would I choose rural Oklahoma? It's really a bit of a random circumstance. Wade Thompson, who leads the WILBURTON, Oklahoma Community Hospital, must have found me on the web somehow. He reached out to me and I subsequently ignored him, but he was relentless in his pursuit of my attention, and eventually I returned his call. He just sounded sincere and somebody that I felt like I probably should talk to for a second. And when I talked to Wade, he convinced me that his community was worth me taking another look at. These are people that genuinely care about the community that they're serving. Economics are almost secondary to making sure that people are healthy and taken care of, and they're continuing to grow and expand their capabilities and services. And when I met Teresa and her team, there was an instant connection, and there was a real shared belief in our interest in taking care of these communities. The reason this is important is that rural healthcare today is neglected. They're underserved, they don't have access, and as a result of that, we see an incredible amount of unhealthy individuals in these rural communities, and not because they want to be unhealthy, it's because the resources that you need to get healthy aren't available in those communities. We're going to make sure that everybody inside rural Oklahoma has the access that they need in a convenient manner. We're going to deliver care to these rural communities like they've never seen before, and in a new and technologically advanced way. The way we're going to do it is we're going to use a lot of telemedicine, we're going to use face-to-face visits, and we're going to use fascinating cutting-edge technologies that have never been used or seen before outside of the Innovation Center here in Houston. This is some of the finest group of individuals we've ever dealt with, and I think this means a lot to our team that we're getting to work with such a quality group of individuals that are committed to their community's health and well-being. I don't believe that this project would be possible or work without the support, guidance, and insights of the Health and Wellness Center in Oklahoma.